There are 31.1% of Victorians 18 and over who have now had 3 doses of the safe, effective and free COVID-19 vaccine. That's the 3rd dose. That's up from 29.7% yesterday, so those numbers are growing steadily, and we thank everyone across the board who's gone and either made an appointment or those that have already had an opportunity to get that 3rd dose. It's critical to stopping the spread of this Omicron variant, and it's absolutely central to us remaining as a community, the vast majority of us remaining protected from very serious illness. If you have a 3rd dose, you are less likely to transmit the Omicron variant, but most importantly, in many respects, you are far less likely, if you've had 3 doses, say compared to someone who's had no doses of the vaccine, from becoming gravely unwell. That is really important. 26,581 doses were delivered yesterday at state sites. Of course, it's part of our walk-up blitz. There would have, of course, been other doses delivered through community pharmacy and GP surgeries, and we thank them for the partnership that we have. It's the biggest Saturday in our state-run system since the 24th of October, so that gives you a sense of just how many Victorians are listening and understanding that this is a 3-dose project. It's not 2 plus a bonus, it really is 3 to lock in everything that we've achieved as one of the most vaccinated communities anywhere in the world. Again, I can't say it often enough, thank you so much to all of those who have had a 3rd dose, all of those who have made an appointment, and a special shout out to those who are in queues as we speak and will be throughout the day playing their part in keeping us safe. We delivered more than 91,000 doses in the last 7 days, so things really are ramping up, but I just again, please make that appointment, please honour it, please play your part for you, for your loved ones, and in many respects, most importantly for those that we all count on, our nurses, our paramedics, our doctors. Their job will just be a little easier if we are all 3rd dose protected. And again, a reminder, that interval is now down to 3 months. So if 3 months have passed since your 2nd dose, you are now eligible for a 3rd dose booster, and we'd encourage you to do that. More than 1.6 million Victorians have done just that. Those numbers continue to grow. That means 2.3 million are eligible as we stand here today, and there are about 170,000 appointments available over the next 30 days. That's just in state clinics, plus community pharmacy who are doing a great job, plus GP surgeries equally right throughout this pandemic have done an amazing job. Appointments are available, vaccines available. It's the exact opposite of last year. We've got everything we need, but the only missing piece is Victorians coming forward, making an appointment, turning up, playing their part, being protected for them and for every good reason, for every Victorian and for every good reason. In terms of child vaccinations, and Sharon Goldfeld from the Royal Melbourne Hospital, who's joined us, Professor Goldfeld, will speak a little bit to being back at school, the importance of that, issues around child health, but particularly child vaccination. But 4,824 children got their paediatric dose at state-run centres yesterday, so those numbers are steady. 166,557 children aged 5 to 11 have received their paediatric 1st dose. That's just under 30% of that age group. So it's steady, it's building, but there is more that we have to do, and I know the Deputy Premier would want me to make the point that there are some 66,000 appointments over the next 30 days for 5 to 12, so for paediatric doses, 5 to 11 I should say, for paediatric doses. So there are appointments available, and again, that's just in our system, plus GPs, plus pharmacy. Thank you to all of those parents who've already made that choice. Thank you to all of those young Victorians who are part of the program, either having had a 1st dose or booked in, and indeed those that are well on the way to a 2nd dose. That's critically important, and not just for now. It's critically important that we have a similar coverage, hopefully exactly the same coverage, amongst our younger Victorians that we do in the 12 plus age group, because we don't know what's coming later this year in terms of other variants, the colder weather, all of those things. Being protected, you can't be fully protected with 2 or perhaps even 3 doses, as is the case for 18 and over, if you haven't, of course, had your 1st dose. So that journey has to begin, and we've made a good, strong start, but there's more we have to do, and there are some 66,000 appointments, so please, the same messages apply. In terms of our numbers of the day, there's 1,002 people that are in hospital. That's down from 1,029 yesterday and down from our 7-day average of 1,085. 120 people are in intensive care. That's the same as yesterday. 44 are on a ventilator. That's up from 37. And sadly, I have to report that 14 Victorians with COVID have passed away, and we send our deepest sympathies and our very best wishes to their families. This will be an incredibly challenging time for them. In terms of case numbers, 6,466 people self-reported their positive rapid antigen test result. They went to coronavirus.vic.gov.au/report, which we would ask anybody in that relevant category, those who've done their own rapid antigen test, please go online and report your positive result if you are positive, not just for the purposes of collecting data. It does give us a more complete picture, but it also means that you become part of a system that's there to support and care for you, and in turn to support those that are closest to you, kids, spouse, family members, those who you are in regular contact with, those in your household in essence. A further 6,625 people received a positive PCR result through the laboratory process. Those results came from 32,435 tests processed. That's a new case tally for the day of 13,091, and that means we have 191,058 active cases across Victoria. 44,000 rapid tests, free rapid tests, were handed out across our state testing sites yesterday. So that number is quite steady, 40, 50, 60,000 a day. That's why we've ordered so many of these rapid tests, and that's why we're providing them free of charge for those who need a test but don't need a laboratory confirmed PCR test at our state clinics. Now today, beyond those numbers of the day, as important as they are, and that constant appeal to get a third dose where you're relevant, to get your kids vaccinated, they're very important messages. But for parents right across the state, we're just a little over a week away from the beginning of term 1, and we know that parents are very keen to have a sense of how schools are going to operate, and today we're able to provide clarity about the very detailed arrangements that we've put in place, the planning, the hard work, the positive partnership, particularly with New South Wales, to have pretty much identical arrangements in their schools and ours. We think that there's some strength, not just for our respective states, but there's strength for the nation in having the two biggest states on essentially the same footing. I spoke with Dominic Perrottet this morning and thanked him for the partnership, and just acknowledged the amount of work that officials, James and his counterpart, myself and Dominic have done. It's really important, and you'll see, I hope, more of that. There's already been quite a lot of elements to that partnership, and I'm very grateful for it. Day 1, term 1 is very important. We want to have our kids back in the classrooms. We want kinder back. We want as little disruption to childcare, and that is a federally funded system, but it's one that we have assumed some responsibility for the purposes of this COVID safety. The features of school returning will be twice weekly rapid antigen testing. That surveillance testing is all about detecting cases, not necessarily every case. That would be almost impossible given the amount of transmission that's in the community, but it's about finding as many cases as we can and shutting down those chains of transmission. So the logic goes like this. We have to get schools back. Once they come back, given how much Omicron is in the community, there will be cases. The testing, free, at home, rapid antigen testing, and the Deputy Premier will speak to these arrangements in more detail in a moment, means that we will find more of those cases than if we were not testing, and then we will be able, through isolation and support to those families, we'll be able to reduce, by cutting off chains of transmission, the inevitable extra cases that would come if we weren't doing that testing. Testing is both a function of Victorian public health advice, common sense, and also about providing some reassurance that we're doing everything we can to make our schools as safe as they can be, but open on day 1 of term 1. You've heard the Deputy Premier speak many times about the more than 50,000 air purifiers and filters that we've been able to source. They will all be at the schools they're supposed to be at for day 1 of term 1. That's very important. It's the biggest program of its kind, I think, anywhere in the country. We're first in with an order. It's been a massive task, but one that is very, very important. We've also put in place a detailed workforce plan. We know that there are going to be teachers who get this. There are going to be incredibly important support staff. It's not just teachers who provide education, it's a whole team of people. So we should never forget the support staff. They will finish up positive, some of them. So we've had to put in place arrangements, and the Deputy Premier can speak to a very detailed plan that sees more and more people available to teach. It may look a bit different. It will not necessarily be identical to what a pre-COVID day one, term one would look like, but because everyone's worked hard to plan, because everyone's passionate and committed to having our kids back at school and keeping them there as safe as we possibly can, then we will get through this initial period. These arrangements will apply for a 4-week period. They'll be reviewed at the end of that. That's a National Cabinet decision. The 4 weeks is relevant given the predicted peak of Omicron cases. So the 4-week arrangements will apply here and in New South Wales. They're the two most comparable states. I'll leave it to other First Ministers to make announcements about what they're doing in their schools, both primary, secondary, specialist schools, early childhood education and childcare. Deputy Premier can go through all of those issues, but I just want to confirm for every parent, for every student, for every teacher and every staff member, we're going to be back day one of term one. It may look a bit different, it will be challenging, but it's critically important that we have our students back in the classroom in as safe a situation as we can possibly build, so that they can get the education, the socialisation, all that experience that's so important to them. Victorian parents and Victorian students, Victorian teachers and staff have given a lot for the best of reasons over the last couple of years. I know that everybody in every school community will work very, very hard over these next few weeks and months to get off to the best start we possibly can. It'll be challenging. Not everything will go exactly as we had hoped. That's the nature of this virus. There's no response that's perfect. But through hard work and goodwill, I'm absolutely confident that we'll get our kids back and we'll keep them there and we'll keep them safe as we possibly can. I'll now ask just before I do, ask the Deputy Premier to speak to the details of what has been a power of work that's gone on these last few months to be ready for day one of term one. We're also mandating third doses for teachers and staff. We think that is incredibly important. It comes off the back of public health advice. Obviously, we've only got a portion of our primary school kids have been through the vaccination program. They've only had one dose. We know that this Omicron variant spreads so fast, and we know that based on common sense and logic, if we can get as many people third dose protected as possible, then that has a positive impact. Doherty modelling has also confirmed for us not only is third dose important, but surveillance testing plays a part, not in eliminating cases, not getting down to zero, but putting downward pressure on the number of positive cases, both at schools and in school communities and in the broader Victorian community. And what I think everyone watching and listening, every Victorian knows, the less cases we have, the less people will finish up in hospital. Now the slight variance in this time with the virus, because of Omicron versus Delta versus the original strain, we're not seeing quite as many people in intensive care. And if you just looked at those numbers, people might kind of scratch their head and think, well, why is this such a challenge? When you've got more than 1,000 people that are in general ward beds, and they're still very unwell, they're just not critically unwell, that does put enormous pressure on the health system. So every hospitalisation, whether it's in intensive care or on a general ward bed, if we can play our part, all of us, to avoid any more of those hospital admissions, to avoid all that pressure that can be avoided if we all just play our part. And I know we're asking a lot, but if we do it and continue to do it, then we can, as the Doherty confirms, as common sense confirms, and the international experience, we can live with this, we can normalise this, but we can reduce the burden and the pressure on families, on businesses, and most particularly on our health system. I want to thank the Deputy Premier and all of his team. The work that's been done to be ready for day one of term one, it's a big project. And in anticipation, can I thank our educators, our support staff, parents, school communities, and of course our kids and young adults. It'll be a bit different, but you'll be back. And that's the most important thing for every good reason.